So we have a small turnout, but we're glad everybody's here that's here.
Yeah.
So we're gonna be prompt and get started. I think everybody here knows each other. Cassidy Pat is on.
How come we can't see her?
I don't know, because we can never see anybody.
We can't.
If she don't turn her camera on.
Yeah,
Yeah.
Oh, yeah. And then Elizabeth's on. Hi, Elizabeth. So you're here, Derek Phillips, who's the superintendent at Pekin, is here. And then I think you probably know everybody else. Connie Boyer is in the waiting room. Good. Good morning, Connie. Welcome. So we're just getting started. So I thought well, we don't need introductions because everybody knows everybody. Connie, this is Derek Phillips from Pekin. It's cool. Otherwise, I think you know everybody else.
Yep.
Okay, so I thought today what we do is an introduction, a brief summary of where we are, give people's input and talk about process to go forward. So brief, try to keep it brief summary. This actually started in 2018 when Dick Lee and Dee were the supervisors, and I was chair that year, and we got an email that said something about opioid settlements. We worked with Pat McAvin, who was our assistant county attorney at that time. And we decided, well, you know, we didn't know of anything at that time. Remember, that was 6 years ago, but we'll sign up because the counties in Iowa were all counties were asked to sign up. So fast forward to now, there's been a lot of just behind the scenes as far as processes to set up how we get the funds and that. So I'm the point person right now. However, I'm really involving Elizabeth because it's a lawsuit settlement. And then also Shannon Pearson from the auditor's office, because she handles those kinds of things from the auditor's office. And I felt it's really important to have somebody that's not in an elected position also get all the information. So whenever I get anything, I send it to them. To date, we have $116,000. Nothing has been spent. The challenge with this money is that it will trickle in into the year 2038. And I have a little spreadsheet here of the ones
take
that
good notes.
I know so far, and there may be some others coming because you never know when we get this. The state of Iowa set it up like this. Iowa Association of Counties is kind of the group coordinating it for the state. So whenever I have questions, I reach out to Christy Harshberger, who's their attorney up there. And she did tell me that there's obviously a lot of questions from counties about this. And so she said they're thinking about starting just an informational Zoom. So when that happens, I said, can anybody attend? She said, yes, I'll let people know if you're interested. So according to this, the total settlement payments that we will receive by 2038 is $400,042. I'm saying that wrong. 442,187.51. So
Could you repeat
4,000.
that? Because I don't read white out.
400.
$442,187.
Yes, thank you.
By the year 2038.
So if anybody wants to see the detail, I'll pass it around if you choose that. So fast forward to now. About a year ago, it was in May, I attended a 2-day conference in Des Moines that was put on by SAMHSA, which is the government organization nationally that deals with mental health, substance abuse. And they did an in-depth dive into ways to use the money, basically prevention, education, treatment. In the email everybody received, you got two things. You got the exhibit, which is the main important piece that goes how to spend the money. And then you also got memorandum of understanding. So, and going to various meetings, there's been a lot of information shared. And Cassidy, I'm going to start with you because you attend Van Buren County's meetings also. Maybe you can just let us know what's going on there, and then I'll do a brief recap of everything and then open it up for people.
So Van Buren County, we're kind of at the same as the other counties, really just trying to figure out what the money should be spent on, making sure we don't already have programs in place that we could use for free. So like when we're talking about education, um, I am available to do a lot of different presentations on opioid use disorder, medication assisted treatment, psychostimulants, stigma, all of those different things. There's a longer list than that. But so we're wanting to make sure, one, if we have programs in place, we are not paying somebody to come in and do those programs. You know what I mean? We want to make sure we're using the money wisely. I know that with Mahaska County, they, law enforcement, the sheriff's department partnered with public health with their director, and they created a new position for somebody who would be kind of like the middle person, a liaison between law enforcement and healthcare when there is an issue with opioid use disorder and some sort of mental health issue. So some counties are trying to create positions. They only had enough money to design a part-time position. And I think they were kind of basing that off of an existing position that is in Wapello County. So yeah, I think a lot of counties though really are at a standstill and just trying to figure out the best way to use this money. In other counties, we have done community forums just to get community input, get people kind of on board with knowing what is going on. So that's always a good starting place as well. The ones that I've been a part of were in Appaneuse County and Mahaska County, and we just had people from the school involved, people from CETA for treatment were involved and prevention. We had Dale Wollery from the governor's office come down. Somebody, just different representatives, somebody from public health is usually involved. And those, in my opinion, have been successful at getting buy-in, at least from schools and things like that, when programs aren't necessarily in place where maybe they should be, if that makes sense.
Okay, and your funding for your position comes from the state of Iowa, correct?
Yes.
And then I know I recently met your counterpart that you do prevention, right? And she does
Yes.
treatment.
Yes.
What's her name? Because she works in our county jail.
It would either be Jamie or Sarah.
Okay,
Jamie, I think.
yeah. And so Cassidy has a counterpart that does treatment, and currently they go work with the inmates and.
Yeah. So that
Really?
program is called LORE, and they are peer recovery coaches, meaning they have lived experience. So they have had a substance use disorder, they've been incarcerated themselves, and now they have been in active recovery for a long time. I don't know the exact dates for either of them. And so now they are able to go and work with inmates. Sometimes it's just important to have somebody who can actually relate to you, who has been through it. So that is that's been happening in Jefferson County for a while now.
Okay, thanks, Cassidy. And I do have a copy of what you sent me for your programs. Again, these are all free. So if you were interested, especially in the school.
I have a question regarding that. How successful is the program? I mean, are they getting people off and staying off? Do we know?
The one in the jail?
Yes.
I don't know the answer to that question. I know.
So the way it typically works is it's a diversion program. When there's somebody in with a substance abuse program that's issue that's in on a long-term matter, Jamie will come in. If they reach out, Jamie will come in and do an evaluation and an assessment. And if the person is interested in substance abuse programming, she can look at alternative placements to jail. Typically what that involves is if somebody's been in the jail for a while, she will come out and meet with them and see if they're interested in a treatment program in lieu of incarceration. And I can't recall the number of people we've gotten out in the last 12 months to this program, but basically she will arrange for a facility to take them. They'll be released from jail to the facility. And then oftentimes we'll work something out that if you successfully complete this program, you show up back up in jail afterwards successfully, we'll amend your conditions of release and process the case that way. So it's kind of a jail diversion program because frankly, it's more useful to have somebody going to treatment than just sitting in jail, twiddling their thumbs when they're in on a substance abuse case. But I don't have stats on that.
And nobody has stats? I mean, how do we know it really truly is effective if nobody's keeping any stats?
Well, I'm sure Jamie keeps stats. My office doesn't keep stats.
That would be a question for her. And
So I think that's important for us to know.
mhm.
So if Cassie could help get that information, that'd be great.
Are you able to do that, Cassie?
Yes, I can do that.
Okay, thank you. I'm just gonna go through a quick list of things that have been discussed at various meetings, and I know there's more out there, and then open it up. I know the Fairfield school system has been a challenge to find somebody that will come to ACT. We know Jay comes when he can, but to get in at like the administrative level. So finally I was able to talk to John Grunwald, and he brought one of the school nurses, just had a brief meeting with he a couple weeks ago, and I think you were there in Elizabeth. And it sounds like because the schools come up everywhere. And I'm glad you're here, Derek. Thank you.
Yeah.
Because everybody's interested in prevention and how can we help? We know the schools have a packed schedule. There is a Botman Life Skills curriculum. It costs money, but that could be something opioid money could be used for. There's a DEA has a free curriculum, Operation Prevention. The Fairfield High School here has someone named Augustine from Four Oaks that goes into the schools, and it sounds like he's the one we really need to talk with because he's a person that's in the trenches, so to say, and really helps the kids. He was not able to come to that meeting. And I know a lot of people want to try to do something. Here's what I learned, and I'm glad you're here, so you can tell me if I'm wrong. It's okay.
No, it's okay.
I learned if you want to do like a curriculum or a program for the kids, it needs school board approval. But if we could start with the teachers, that needs principals as a place to reach there and get their support, because they do have teacher, what do they call them, education days or
Like professional development days.
professional
Yeah,
development.
PD
Yeah.
days.
So that's kind of the schools in a nutshell. Anything you'd like to?
Yeah, no, I mean, it's, if you get a new curriculum, you have to leave it out. I think ours is like 30 days for public viewing, which we would just set it in the central office and people would have the option to come view, and then it would take, well, it's I think 2 board approvals. They'd approve it once, a first reading, second reading. Maybe they might be able to do it in one actually, because that's not board policy, but you just have to make sure that you, in a sense, not forcing it on people, and that the community has the option to look at it. So it's, I don't want to say it's hoops to kind of jump through, but sometimes it's some hoops just to, if I know it's good and I want it, I can't just come in and say, this is what we're going to do.
Yeah.
You have to leave it out, and yeah, it's kind of a pain, but it's okay.
I know there's a presentation called Tall Cop, and I know you've been to it. That's been very well received for the people that have attended it. And so if there was ever an occasion to have some kind of a community education event for parents and for students, how would that look like in the schools?
Yeah, I think anything, a couple things I see with this from a school standpoint is anytime you can have something that, whether it's with adults or whether it's with students, that continue to carry on. Like, it's great to bring a speaker in, that's wonderful, but what's the follow-up?
Exactly.
And we tend to not do that sometimes in schools, and that's I'm sitting here, I'm throwing me under the bus. It's my fault too, but we tend to we'll go to a conference and it's great. And okay, great. But what's a continued follow-up then?
I don't think it's
You know.
just schools.
Yeah, no,
You're not
you're
alone in
right.
that. You are not alone in
Yeah.
that. You're
It's,
not
it's,
alone.
it's not just, I agree, but it's like so what's going to be that if we get something, we can bring a speaker in or whatever, but then what's going to be the follow-up, whether it's curriculum or whatever. So with parents too, I think it's great to have a community night or something because it starts with our parents at home with our kids and making sure that they are educating them on drug use and I mean it's happening. It's happening in Fairfield schools, it's happening in Pekin schools, it's happening in every school in Iowa. There's students. I mean, I tell you an example. We had a kid that pretty much went through a full detox in our office. I mean, on his own, his choice, great, but I mean, he was on some hard stuff and he admitted to us, he knew it and now he's in a better spot, but that stuff is happening here and parents, oh, we didn't know that. Okay. Well, I mean, there's signs, so how do we get them involved? But then that follow up, and that's where I don't have a great answer for parents. With kids, I think we could have a curriculum and have continued follow through. How do we get parents to have that buy-in long-term wise? So it's not just to sit and get one night, great, and here's something we offered as a speaker and you came in, you watched, that's wonderful. What's that follow-up look like? And again, I hate to give a suggestion, don't have a solution for it. I don't have a great answer for that, but we have to get that continued buy-in with our families,
Okay.
whatever that may look like. But as far as squeezing in, a new curriculum and things, it could hit some health standards, and we're actually considering going to an 8-period day from a 7-period to have more classes. So I think this would be a natural transition for Pekin to have something that we could, tie into that. I don't think that would be a challenge for us at all.
I'm curious what the statistics are on that note. Like, do those types of classes as education programs have a long-term effect?
I don't know.
Are you skeptical?
A little bit, and I don't think we could do like a full-on class like opioid prevention 101. I think we could have something where it could tie into certain classes, whether that be in our business classes about making healthy choices, health classes, PE making healthy choices. That's what I see it like tying into. I don't see it as like a whole separate class. What are the long-term effects or benefits? I don't know, truthfully. I think starting early, is it something where we could utilize Officer Porin a little more, and get her trained in some of these things to go into classes, because she's our full-time school resource officer there. That's going well, but is there more, early intervention? I mean, it's just like reading, right? If we don't catch them by 3rd grade, the statistics go way down that they're going to be able to be a successful reader. Well, I think it's some of the same with this, teaching them just overall good choices at the early level, I think is huge. Why do we keep our hands to ourselves at recess? If they hit in kindergarten 1st and 2nd, they're most likely to be those kids that hit in 3rd, 4th, 5th, and all on. So I think that's where, hitting some of the harder choices and things, yeah, maybe at the high school level, I think is important. But also when I think of, and I glanced at these, I didn't look fully, but to me, it's about the huge umbrellas, just making good choices. And when someone approaches you with maybe a not good choice, you can say no. And how do we do that? That's lower level. That's kindergarten, 1st, 2nd grade stuff.
Well, and when they come from homes that are users,
Yeah,
they're not going to know to say no because they see it. They're
Right.
living it.
exactly.
When the households are
Mhm.
using, that's a whole different level of
Exactly.
acceptance.
And
That's
that's
your daily life.
You're spot on. I mean, because
Yeah.
you're telling mommy and mommy's boyfriend or dad or whatever they're wrong.
Yeah, and they're afraid they're going to get.
They are.
they're
They
afraid They're
are.
going to get beat and put in their room.
So school says it's wrong, but
Yeah.
mom and dad are doing it
Yeah.
and they're okay.
Yeah.
That's tough. That's
It
tough. But
absolutely is.
I think just keeping them on and making sure, eventually we'll see like, oh, if you keep on them and getting those good positive role models at school. So that's where we're in a tough spot too.
At that SAMHSA conference I went to, they said, start a lot of these issues start with 9-year-olds, which
Oh,
really
yeah.
surprised me because
Oh,
that's when they
doesn't
start
surprise
to
me at all.
I would imagine
self-medicate
younger.
in some fashion because they just don't feel right.
Yeah. I
Not,
think it's probably younger than that.
not
honestly.
recently, but I mean, we've confiscated vapes from, second graders.
Yeah. 7-year-olds.
Yeah, easy, yeah. Well, I mean, and it's so, how
'Cause it
easy,
tastes good.
when you think of vape, how easy is that? Mom and dad, I just take it from mom's purse. It tastes good. Wow. And they don't know, like, and I don't think we fully know the long-term effects of
Yeah.
vaping. I mean,
Mhm.
we're,
Great.
you know, we're a, you know, when they used to send cigarettes in World War II, you know, stuff, and now we're like, oh, that caused lung cancer. Whoops. You know,
Or
now
you
I,
smoke in a hospital.
yeah, you can smoke in a
Yeah.
hospital. Like those are things like right now, this generation, we're getting there, I think, but we're like, I always tell kids, you're an experiment right now. Just wait and you'll figure it out. And unfortunately, you are part of a test right now, but you know, that's where I think I look at what would be the most successful, getting them early,
Absolutely.
getting them early, getting them often and teaching them. You know, it's teaching them right from wrong at an early age. That's with anything. So early intervention is the best intervention. But I also see some benefits too. Like I'm thinking of this student. How can he came to us knowing, and again, I'm sure there were resources we just didn't know about necessarily, but he came to us wanting to make better choices and we really just kind of sat him in the office and let him shake and sweat it out and kept him in from class and things like that. So how do we help those kids too that have maybe gone too far where the pre and that intervention didn't necessarily work? So that's where I see it can be very, very beneficial from a school standpoint, which then in turn helps out the legal system. It helps our jail system. I mean, that's, you know, we know that, you know, if you're incarcerated once, what is it, like 80% come back again? I mean, it's kind of the same with our users. If they start, how do we get them not, in a sense, how do we get them to even not start? Because once they start, it's hard. They get
Prevention is a
addicted.
little late once you started. Yeah.
Exactly.
I mean,
So that's why, how do we, you know, catch them early, catch them often, teach them from an early age.
And
So,
the speaker
May-
taught
may I-
that.
May I say something regarding that? I mean, I'm not disagreeing with anything. I think what you're saying is spot on, and I think having peers that have been through it, you may be just a little bit older, that can talk to the kids. Years ago, a Rotary brought in a basketball group, and I've been trying to remember their name. And you know, these were young adults talking to the middle schoolers about drugs, about sex. And I, as a parent at that time, I was like going, I mean, it made me nervous because they were talking about these things. And the teacher said, no, the kids need this. I mean, I thought it was a little too much, but anyway, I think that's helpful. And I think it has to be series, you know, and even with parents, I think we have to have a series of speakers because it can't be a once a year thing because not every parent can get there. And I think it has to be a series with different topics, you know, what to look for in your kids if you think they're doing drugs. These are the kind of signs. I think we need to and this is kind of stuff that we've talked about in the mental health group is a series of speakers teaching our parents how to look at the kid's phone. You know, so that they can understand what their kids are doing on their phone and are they talking to other kids about drugs, you know, social media, etc. All of that comes into play. And so if you have different speakers from different areas, law enforcement, you know, Cassidy from prevention, you know, if you set those up once a month or once every 3 months or something like that, and those might be, you know, low cost things that we could do if we just continually have a series for kids and parents, and so that it's just not once a year a big blast, because that's not going to help us in the long run.
no.
It has to be continuous.
I agree with what you guys have said. I just want to take a couple steps back and revisit the Alcohol and Tobacco Free Coalition and how it came to be. It was a grant. Jefferson and Appanoose County were number 1 and number 2 in underage and binge drinking in the state. That's not something you want to be number 1 and number 2 in. So as with anything, the state sees a problem, so they're gonna throw some money at it and try to fix it when it's not really gonna fix it long term, because once the grant money goes away, then the program goes away. So we had great representation from school administration, from Pat McAvan. He and I like co-chaired it. We had somebody from CETA, Kitty, in addition to the grant coordinator. And it focused on the specific underage and binge drinking. And I mean, juvenile court officer was involved, Cecily Shinstock at the time, who was wonderful, and she's not here anymore. And then we had Karen, who's gone up the tree, and so she's not here anymore. But it was a specific objective and a specific deliverable. And we've honestly been struggling a little bit since then. That grant went away years ago, and then pre-pandemic, Pat and I had a conversation. I'm like, do we want to keep meeting? You know, because really the Alcohol and Tobacco Free Coalition, we continue to meet, but really it's just it's really a dumping ground for information for people that provide community services. Okay, so like we have people from CETA, the health department, the hospital, law enforcement, whoever can hops on and gives an update from their lane of service in the county. And it's really good because a lot of times people don't know, and we all change jobs or services change or you get new people, whatever the case may be. So really, we've been struggling with that post-pandemic. But I have to say, and Stacy's out of the office this week, or she would have been at this meeting. But she and I, Stacy Worley's our ER manager, and she and I have talked numerous times, and we're on the same page. You have to target these kids with information from an early age because they've already been exposed to it. They've already been victims of abuse. Some of them could have already been human trafficked by the time they're 9. And that's a terrible thing to say, but that's the reality of it. So you have to start much earlier than what we feel comfortable with as adults and as professionals. So with that being said, years ago, our hospital had an inpatient psych department. We had a 10-bed 10-bed adult and 8-patient inpatient psych. And one of the psychiatrists, her specialty was addictions. And so that was in the mid-90s. So we've gone backwards in mental health, and Sandy unfortunately is not here today either, but we've gone backwards and stuff is so fragmented. And our schools are charged not only with education, but with parenting, grandparenting, rules. I mean, they basically raise your kids, right? If you're not involved, let's just call it what it is. I mean, I have 2 grandkids, and the stuff that Jameson comes home, he's 7, and he'll say something, I'm like, you know, what? It just blows my mind, right? Because a 7-year-old of today is not a 7-year-old of the 1970s, let's just be honest, or 80s or 90s. So I think that there's a disconnect between actually accepting the bad stuff that's really going on in our community, because you have to objectively look at it and say, oh my gosh, my child or my grandchild could be a victim of sexual abuse, sexual assault, human trafficking, exposure to drugs. Because we know that that really does happen. Because if you look at adults that are incarcerated, you go back and you look at their ACEs scores, which are the childhood trauma experiences, probably 9 times out of 10, there's some kind of traumatic abuse event that happened in their life. That's not right or wrong, and I don't have that stat in my head, but I'm thinking it's pretty close. So we know that bad things happen to little kids. So if we can, in any capacity, provide information not only to parents, but to other adults like grandparents or guardians, because I'm going to go back to Tallcock for just a second. He flew into Cedar Rapids and he took pictures in quick shops in Iowa from Cedar Rapids to Keosauqua for things that kids can have access to precipitate their high. And Cassidy, you probably know a lot more about this than me, but I mean, you don't think about Imodium. I take it for diarrhea, right? That's what it's used for. No, you can take it with drugs and it precipitates your high, so you're high longer. All of these things, all of these, we talked about, you know, all of the tobacco products and non-tobacco e-cigarettes and all that stuff. These kids have access to all of that. We're going to have a whole generation of kids that need lung transplants at some point because it tastes good. We don't know the toxic chemicals that are in those. We do know what's in cigarettes finally, but it's not even close to the same. But for him to take pictures of stuff that's on the shelves in Casey's, Come and Go, whatever quick shop he stopped in is unbelievable. Now, would I have known all that? No, and I think I got a pretty good finger on stuff that's going on in the community based on, you know, where I've worked and what I've done in my professional career. And I think denial is an amazing coping mechanism for a lot of people, because if we don't talk about it, it doesn't happen. The same thing with emergency preparedness. We don't want to talk about a school shooting because it might happen. Well, it might happen anyway. I mean, obviously, look at what's happened in the Fairfield district in the last few years. It wasn't a shooting, but obviously there's things that we have to get to the root cause and try to do a better job as professionals within our communities. I don't know what that looks like. And you can't make people come to a meeting. You can't force education
Yeah, I was
on
gonna,
anyone.
that's what I was gonna just previously been in roles, setting community events and you're gonna get a handful of people that come just because they want to be involved and like to come. But how do you get the people who
It's
need to
not the right
be-
people.
Yeah,
Be
the
in
wrong
the
people
room,
come to
in
the
the
meetings.
room. And that's such a challenge. So I'm all great to have education meetings and that kind of thing, but yet you have this whole gap. And I don't know if it's working through the medical world to do that, if it's working, we have to get creative.
I know when we had a couple speakers come, and I can't remember who it was, and these were people that were from the world of addictions. They were users themselves, and they did like a panel discussion here at the convention center. And then if the high school kids came with a parent to that presentation, they got community service. We signed off on their, like, I don't know, it was hour and a half or 2 hours, however long it lasted. We signed off on that for them to get hours of community service.
Yeah, there has to be an incentive.
Yeah.
This is the direction that we're exploring with, early intervention and education in the school system. You mentioned the juvenile courts officers. I think we should lean on them heavily because this is what they do. And these
Yeah.
are the resources that they have. When a kid gets in trouble at 16 with a vaporizer, they utilize that, and send them into some remedial training programs or things like that. So they probably have information and details on what's a workable program. So-
Well, and she does
Sure.
come to our ACT meetings. It used to be Karen, and then tell me what her name
Right.
is. Shelby? What's her name?
Not Shaley.
Shape. We've had a lot of changes. I'm
Yeah.
still struggling with names. So she does attend the ACT meetings
Yeah.
when she can, which is good.
We were talking
Bart.
about, Cassidy is on Zoom from, that works with the prevention on the opioid. And then can you talk a little bit about what goes on in the jail? And Connie had a question. We briefly touched on it. Do you have any statistics on the success of that program?
Sarah did that day we
Yeah.
met. I don't have it with me. They're actually there right now.
Okay.
I guess I can get that for you.
Well, we don't need it today, but it'd be helpful to have
Okay.
that question came up. But yeah, we think they have some, and Cassidy's also gonna try to look.
Okay, because I think they're coming up on 2 years being involved with people who are there,
Mm.
drug addicted. So,
So the conversation thus far has been focused mostly on the schools, and what we could do. When this first came out, I did contact the sheriff and ask just for input, and this has been probably a couple of years ago.
yeah.
And so this is from his list. Training and education for staff, not just limited to drug and alcohol training. And one of the things at this conference I went to, they said everything overlaps. So you don't have to just say it's opioid specific, anything in that whole world of substance addiction is probably fair game because of the overlap. Equipment purchases pertaining to drug and alcohol testing, dipstick kits, SNCC kits. Now, this is one that comes up in about every group and it's on everybody's list, housing.
Yes, it is.
So now, Bart's suggestion was alternative housing fund as additional funds other than ministerial alliance. So have you found success with the funds that the ministerial alliance has? If we could help either supplement that, or do we need is there
And I think that program's kind of going
a way?
ways away.
Okay,
That was basically your churches that were part of that.
Good.
no, I'm familiar with that because people would go from church to church
Oh,
and, yeah, I even, you know,
Which I think they decided to put most of their resources in like the well and stuff.
Okay.
If I'm there with it right, they're kind of not doing that and focusing more on the well type stuff.
More of a central point of
Yes,
distribution of
central
that,
point.
yeah.
like the pharmacy.
is anybody familiar with the well services and what's going
Yeah, but
on?
it's been a little while ago. I know some things have changed, so I can't speak to everything that's going on, but I need to invite him.
It would be good to just have them come in and let us know.
Chris, who is that?
Was it Jason?
Oh, he's the head.
Is it, yeah, but he's the one that,
He's
from
the-
Pella, yeah,
Yeah, no, because I talked to him like right before COVID.
yeah,
We
yeah.
went up, Josh Larrabee and I went up and toured that.
yeah.
Mhm.
So, you know, and we work with the Lord's Cupboard, you know, for food. I mean, Deb will go or
Yeah,
go do blood pressures or,
they gave COVID shots there.
you know, so that's a point that we have contact with a different level, but everything's all encompassing. Food, housing, access to healthcare, whether it's physical or mental health care. And the thing of it is, if you have a kid and you're on Medicaid or Hawkeye, well, Medicaid especially, you're gonna qualify for all these services. You're gonna qualify for SNAP, EBT, you know, WIC. You're gonna, especially if they're birth to 5, you're gonna qualify for WIC, women, and infants and children. So you're gonna have that food, probably free school lunches. I think ours is what, 52%? I don't know the exact number, but it's half in Fairfield. It's over half.
What is it in Pekin?
I think we're close to 40
So.
right now, free reduced.
Yeah, and then if you throw in MSAE, you know, they don't do lunch, they take their own, I think, but at the private school, but it's all encompassing, all of the things that we're talking about that. I gotta go back to the gambling thing for just a second, because Carol Ullman Davis is the gambling counselor that serves Jefferson County, and she's involved with a lot of stuff, a lot of, you know, the ACT meeting and different meetings, so she has representation. We have a tobacco grant in Jefferson County, tobacco cessation, so that's covered. They're out of Iowa City now, used to be CETA, everything changes. And this is just, it just gets so complex trying to remember who's affiliated with who. And let's be honest, all these positions that are grant funded are not really sustainable. Because once the funding goes away, everything else goes away, the infrastructure goes away. And that's the really frustrating and challenging part of it, because the physical part of our healthcare is not like the mental health part of our healthcare. You don't treat cardiac patients or OB patients the way we treat mental health patients. We don't treat them like that at all. And it's mind-boggling to me that at this day and age in the healthcare delivery system, we still have disconnects with people that have addictions issues and mental health issues.
Right.
On the note of that grant funding, I mean, if we're looking at 442,000 through 38, that's amounts to 31,500 a year. So
Yeah.
That's a
Wow.
part-time.
That's,
The other thing we can look at, and I talked to Ashley at Pathfinders about possibly writing a grant, and I need to talk to the supervisors about this, is Chris Rankin, who I know Cassidy, you're familiar with, and some of you are too, at Van Buren County, is funded by 2 grants. One's a SAMHSA grant and one is a Drug-Free Communities Notice of Funding Opportunity Grant. Because I'm asking her, I'm like, how do you have money to do this job? And she said, I'm totally grant funded, and apparently it's a pretty, I'm not gonna say simple grant, but straightforward grant. So I wondered if that would be something we would want to possibly apply for and have Ashley write a grant. I think it's due in June, yeah. So it's coming up, we would wanna do that. Just to get a position to help do this. I also asked Elizabeth early on about, and it's in the fine print, so I read it. Elizabeth, you'll be proud of me. There's only 2.5% for administrative cost of this grant. You know, a lot of grants you can have up to 10%. 2.5% is like nothing.
nothing.
So it's not like,
That doesn't even pay for postage if you get mail anything, let's be honest.
so just in case anybody had that question.
So in a perfect world, if cost wasn't a factor for anything we want to do, what would we want to do? I think sometimes that's the thing.
Yeah.
You got to start kind of there
Well,
and then figure it out, because you can want everything, but you gotta narrow it down, you know, and I can't speak for our schools. I mean, they know what goes on. I know Fairfield does have a ton of infrastructure with mental health services. They got people in and out all the time. We've got lots of mental health providers. We have a new nurse practitioner, psychiatric nurse practitioner in the community. I mean, so there's lots of things going on to support that.
Is she at the hospital?
She is she's with River Hills and they
Oh.
rent space at the hospital. So there's lots of things going on. So I think what I would ask our school partners, and I've asked Jay and Alicia Roop, who's one of the school nurses that's attending, to kind of come up with what they would need from us as community partners. Because I can't go into a school and say, hey, this is what I think you need, because you guys know, you guys are in it every day. And we're glad that you are. But I think that's kind of what, as public health, I cannot tell anybody what to do or make a decision. I gotta have the input from them, because they're like
Does the
Bart, I'm gonna
job.
ask Bart, what works, what doesn't, and then tell me, and then we'll figure out what we can do. I don't
Well,
know, Dee, that's,
And the other thing at this training was, they said either pick one thing and do it really well, or else find the gaps and help fill in the gaps. So they really made a point. That was kind of the major take-home message. The other thing that comes up besides housing is transportation. Whether it's transportation to court, you know, people walking from wherever to show up there, or transportation to their substance abuse, all those things. Mhm. And as far as schools, this ACT meeting, if you're interested, you can attend by Zoom.
Okay.
I
it's
can,
the second Monday. I could answer.
it's a good place
Sure.
to
We
make,
invite Dana.
Oh, yeah.
Chelsea,
Yeah.
the school nurse, but
it's a good place to find resources,
Mhm.
because the people who attend that talk about what they do. So, and most of those folks, other than the schools, would be countywide
Sure.
people.
so just to review the CHOP chip, the health assessment, health improvement plan. These are the things that we've identified. It's poverty, housing, mental health, substance use, access to healthcare, and there was one more. What is it? I can't remember off the top of my head. Oh, maybe it is just 5. But I'm just gonna throw this in the mix. The state is doing their magic shell game at the state level, moving things around again with Health and Human Services. So they're changing the mental health delivery system yet again, and we don't know what that looks like. And then all of those umbrella of services, those 19 other services under the HHS umbrella, including public health, will look different in the next 5 years. And we don't know what that looks like. Anytime they regionalize anything, then things change, whether it's extension or AEA or area agency on aging. And again, I said this earlier, the state doesn't pay our salaries. We're county employees first. So you want to make sure that your residents are taken care of. And we have to know what you guys need from us to try to help facilitate those things. So I don't.
So the things that you mentioned,
Mhm.
the 4 things, that has everything to do with helping the parents, as far as I'm concerned.
Yeah,
And I think that if you guys can't see it, it's the young kids.
yeah.
Because I worked with so many of those kids that were offenders by the time they got to be 14 and 15.
Mhm.
When I did that program for Indian Hills, it was too late.
Yeah, it's
I mean,
too
you could have
late.
saved some,
Yeah.
but let's get real. Help the kids, help the young
Yeah.
kids.
And our nurse consultants, Mandy and Tammy, go into daycare centers, daycare homes and preschools
Mhm.
and provide technical assistance and support in a medical model, basically.
Mhm.
And they do checkoffs for like medication administration, but then they work with the AEA or they work with other providers if they've identified, hey, this child is not progressing physically or emotionally to the level that they need. But again, that's only a small portion of the population. We could work with the physical health providers and then the mental health providers, but that takes a lot of work to try to, I mean, we get phone calls. It's like, you know, where do you send people or what do you do? And it's like, sometimes we don't know. We're like, we're gonna have to get back to you because we don't know, because things change within the community. But I personally think and professionally, I think that to start with awareness is an important thing. Because if you're a grandparent, let's just say, and I'm not being, if you're a grandparent, I'm 60. So if you're over 60, you really don't have a clue what these kids are doing. You don't know what a vape looks like. You don't know that they're buying Imodium to precipitate a high. You don't even know what some of these drugs look like.
Chris, how old are you?
60.
Are you, well, see?
Yeah,
You know.
but what I'm
Come on,
saying
that's what I'm
is,
saying.
and the drugs that we see in today's world are not the drugs of the 60s and 70s.
look
They
like
also
gummies,
said
they're-
psychedelics
yeah.
are coming back. And the thing of it is, we went to another presentation that was put on by a deputy in Mahaska County. I can't remember his name. And it was put on in Washington. And
That was good.
he worked for the state undercover for years. And like, he had pictures, like they'd go raid a home and they'd have a bag of what looks like gummy bears. And you know, they're not gummy bears. These kids will eat them. I mean, so just to bring an awareness to the community, because people don't have a clue. They don't.
But how or where does that look like? Just because, you know, the people that want to be there will show up, but those
I
are
don't
not.
know. I don't know in the court system if there's a way to make
Yeah.
people take training
like
and
they're-
education.
There has to be some incentive, some
Right.
reward for them to have to, to go.
I mean, and look at all the people that are exposed to fentanyl indirectly
Yeah.
and die.
And is it true? I thought I heard recently, because somebody, and I had suggested once upon a time fentanyl test strips. But isn't that a law that you can't like just hand those out? They have to be used for,
I think
It's not black and white. It's,
Yeah.
they can be considered drug paraphernalia if somebody really wanted to jam somebody up.
but it seems like if our goal was to save lives, at least in today's world, if we could help people test what they're doing, that might raise awareness for them that, oh man, I really could have died if I would have taken that. And, you know, we might catch a few that would help them turn around, but I don't know.
Yeah.
It just seems like if there's something that can prevent that, that's not as complicated.
Some health departments distribute Narcan. Some health departments have a Sharps program.
Well, and Narcan certainly, you know, that could be used to be purchased with these funds if that was a need.
Yeah, I think you get it free at the state. Well,
You could get it free, so do not
Taxpayer
purchase
funded.
it.
yeah, taxpayer funded, nothing's free.
Yeah, okay.
Yeah, but yeah, you're right. I think when
Yeah, one of the questions I asked was, does everybody have the resources they need for Narcan or whatever other things are used? Again, I'm ignorant, so I don't know. And Cassidy said that a lot of those people can get it free from the state. No, you're right. It doesn't come free. We're all paying for it. But
right.
the point is the schools, the ambulance, et cetera, can all get that. And from listening back here, what I have died, you know, just hearing you guys talk, it's obvious that we want to get to the kids early. Parents and grandparents need educated. So, and I agree with what Dee's saying and what she's heard. We need to pick one or two things and try to do that well, because that's really what we can do, you know. And I think if we identify, you know, I think we all agree on those two things. So it's getting different speakers in and you know, deciding what those things are, whether it's speakers or, you know, in the schools, maybe it looks a little something different. And then we've got to creatively try to think how to get some of those people there that need to be there. And
An idea there,
and we need to have it videotaped so that it gets out on YouTube or our local sources, because sometimes people won't come, but they'll watch it on their computer. And all, you know, that kind of thing could be a flyer, take it, you know, the kids take home so that all the parents or grandparents get it. I mean, that's just one idea. I don't know. But I do think we have to creatively think, how do we get, I mean, we all know that that's an issue of getting the people who really need it to be there. But, you know, other parents who are good parents and still ignorant still need the information too.
Yeah, exactly. Because kids are smart, they're resourceful, and they lie.
you know, a couple of
Yeah.
places that we might be able to put just a flyer with either resources. And this would be probably a little more. We talked, I think, at ACT about a one pager for some meetings.
Oh, to get off.
Yeah.
We used to do that monthly.
But we could do
Cecily and
that.
Pat would do that.
I did talk with Drive By Supper. We could do that over there. And see, that's a pretty broad variety, but as far, and we could put information like this, that there's a community program, or look at this YouTube site to see. I think we'd have an avenue there to distribute to people who otherwise might not come to a meeting. So again, thinking of some of these existing food pantries, I'm sure they'd be willing to help us out too.
Hey Cassidy, does anybody do any kind of like training or education like on Facebook Live or, like a live feed? I know Connie referenced YouTube, but will you?
As far as I know, we have not. The only thing that we have live streamed was the community forum that we held for Appanese County, because there was a large number of people who said the time and date didn't work, so we wanted to make sure we caught them too.
Okay.
As far as I know, though, through our like state guidelines, we probably could do a live stream. I don't think there's any stipulations. There are some like rules, like we aren't supposed to send out the PowerPoints to people who are not going to be at the
Right.
presentation, blah, blah, blah. But there's always, ways around things.
That's a good idea.
You gotta sit through.
Because
the-
you might get some
sit through
people
education to get the-
there who otherwise would not attend something. And the goal is awareness, so it can happen in many ways. Connie?
Well, I was just gonna say, would you be open to the mental health group trying to put a series of speakers together for adults? And then present something to you, and, hopefully a lot of the things could be low cost, because I think we might have a lot of speakers that we can tap into that are community resources.
As far as, would it be opioid focused, drug?
It'd be
drug
education
prevention?
focused for parents, grandparents. I'm just thinking it's something they could do and then present to your group. And, if they want to bring in Tall Cop, for example, then to say, okay, this one does cost money. Would you be open to that, paying for that kind of thing? So,
Right.
I'm
No,
just
I-
trying to maybe get a focus of the one group that's already talking about it, and they want to be action oriented. So, maybe they do it.
Yeah, I mean, if they want to put together a proposal, that's certainly fine.
Is the whole group open to that?
I will, I'm just gonna interject one thing here, because we were talking earlier about knowing whether or not programs are useful. And so if there's a way that we could kind of hone in on some like evidence-based programs that we know are gonna actually have an impact, I feel like that would be a better use of our time. And I'm not quite sure how to assess that. Maybe Cassidy talked about getting some information about the benefits of some of the programs that she teaches, but just if I do that.
Cassidy, what, do you have programs for very young children?
So the presentations that I do, they are not typically geared towards very young children. Just through state guidelines, they don't want us talking to kids really under high school. However, there are people through the Integrated
course.
Provider Network grant that
Or where?
have school specific stuff going on. Now, I will say I have presented in schools with middle school and just kind of didn't mention how old they were. Because again, we know that reaching younger kids is the most important thing, because by the time they're in high school, my middle school kids that I talked to, one of them was talking about they watched their brother overdose on heroin in their garage. And then two other students were already, involved in having to do UA tests because they got caught doing something at school. So, and again, those are like 12, 13-year-olds that I was working with. So I'm happy to share who I know that could do school-based stuff, if that would be helpful. But again, when it comes to really young, like third, fourth grade, which is really, kind of where we need to be for sure, that is limited.
Well,
So
I
do you
think-
work with adults then, Cassidy?
I work with adults. Our target population, I think, technically is like 18 through 45, and then there's another grant for like 60 plus maybe. So yeah, I have different
But you
guidelines.
could potentially work for the parents and grandparents. You could do some
Yeah.
programs. And
Yes.
again, your cost is free,
Yes.
courtesy of the state of Iowa opioid funds. Thank you.
Yeah.
So that's a place that this group could start with, talking to Cassidy and trying to put some things together.
Yeah. And Derek, I think you had a really good point. And is a lot of it's just about teaching the kids how to make choices. And I think, is there an evidence-based program out there that I think that we could help? And Elizabeth, if I'm on the wrong track, straighten me out. She's kind of the person I go to when it's like, are the funds appropriate to be used for this? But it would seem like that would be a good way to open the door to this, whether you're not just saying, oh, we're educating about drug prevention, which people may or may not show up, but if it's how to make, because I know with my grandkids, I always hear, is that a good choice or a bad choice?
Yeah. I think that, doesn't Iowa State have an evidence-based program of some sort, like Superstars or something? I don't know the name of it, but there was our colleague at Extension years ago, and we could ask Courtney since she's out there now, but there used to be an evidence-based program for the middle school age, and we tried to get that through here, and it didn't go anywhere because of what we just talked about. The timing of the school day,
Yeah.
and then the buy-in from people that might not necessarily want buy-in for that program. And then, the limited amount of time that you're with the students, because anytime you change a curriculum, it's not easy. But I can't remember the name of that. Joyce Lash was the contact person, and I cannot remember the name of it. But there is an evidence-based curriculum of some sort for healthy choices and stuff.
So I think, going back to Connie's summary, which was good, Connie, it seems like if we wanted to do some programs, if we could do some kind of a live stream, that would be another option. So it'd be like an on-site, probably starting maybe with parents, grandparents, because we don't need parental or school board permission for that.
Right. Like that.
We're trying to make it easier.
We gotta start somewhere.
And we could even, if you think it's useful, do it under the umbrella of the mayor's town halls, where we're inviting the public in and we want to talk about this topic. Not that I want, I'm not asking for a pat on the back or anything like that, but sometimes, that does generate some interest, if you will, that it's not just, I don't know. It has maybe a little more clout of getting people involved and interested.
Yeah, I mean, that could be one of several strategies.
Yeah. Yeah, just a strategy. Not that it's not the perfect, end all.
So where do we want to go from here as far as any kind of process? Because I know everybody has plenty of meetings, so I don't want to be respectful of everyone's time.
I know for me, I want to look at some younger school-based program things, and just because I don't know, so I'd like to, for my own knowledge, just to try to see if there's, something. And it'd have to be to use the opioid funds, it'd be a loose tie-in, but I know with grants and things, you can tie a lot of stuff pretty easy. But when we talk about, again, I'm big on early. If you don't catch them early, that's great. We can talk to high school kids. The percentage is just, the older they get, the higher, or the percentage that goes down of being able to change.
Your little handout that everybody has, it's B2. Provide
caller.
education to school-based and youth-focused programs that discourage or prevent misuse. And it also says, that's under
Mhm.
opioid related, but they made it clear in Des Moines, anything drug prevention, substance abuse prevention
Yeah,
is
and-
it's
and-
all okay.
And I think you argue like, well, making, overall at the younger age, I just don't know, is there a K-6 program that talks about in the K-1, 2, making good choices, then it starts talking about drugs and things in 3, 4, 5. I have no idea. So that's what I would like to do my own kind of research and see if I can find something.
Yeah, but then life skills is one that had the curriculum. It's BOTVIN.
Okay.
That's the one that costs money. And then the DEA has a operation prevention. Those are two that I know we've become aware of just in various talking with people. And if anybody knows of any others, but those would certainly be evidence-based.
Mhm.
One thing we talked about a little bit in my office is in the exhibit E, under section G2, prevent misuse of opioids, talks about corrective advertising or affirmative public education campaigns based on evidence. And I don't know how much evidence there is that this would be effective, but, some kind of public information campaign about when there are overdoses and when there are overdose related deaths, getting that information out to the public in a broad way. Obviously the people's families and friends know about it, but I think that it could be useful. I mean, particularly, if there's a particularly bad batch going around, there's the thing last summer when 8 people overdosed in, 2-week period. Getting information like that out through a public information campaign, would certainly be approved and might be effective,
So public health on the radio.
right?
That, or I was gonna say Connor's always,
He's hungry
if
for
he
stories.
wanted, as a county attorney's office wants to issue something, he'd be more than happy to,
I do.
Yeah, he
And you
would.
would just need to make sure he had the names right.
and give him a written,
Yeah.
press release.
Well,
Or whatever it
and
is.
that might impact, people's privacy rights if there's no criminal action associated with it, right? We don't want to just say, Bill overdosed yesterday, give him our best wishes,
Well, that's where we
No,
need your
that's-
expertise to know
Right,
how to,
right.
how to message it.
But some type of public information or education campaign could be a
I agree with you
good
on the kids.
thing for everyone.
Wherever they are.
Yeah.
Because I think it's helpful if people know, because I know somewhere in the, boy, Chris, if you, or Deb, if you could help us on somewhere in the public health website, there's a magic dashboard that will tell you by county.
Oh, yeah, yeah.
If you could find that, that would be something we could
Yes.
say, there are X number of, is it, I don't know what the measurement is, was it hospital visits or?
Oh,
was
yeah,
it-
they track all sorts of
Yeah.
data at the state, all sorts of data.
But
And then
if
they
you
just
could get us
disseminate
some
that.
Jefferson County numbers, I think that helps to bring it home, and we could certainly
And
promote
that that's right
that.
to your,
And those are free things, Chris, on the radio.
Yep, I'm going there tomorrow.
See, there you go.
Yeah, there's all sorts of, and they've redone their website at the state level several times. It's like, oh my God, trying to find stuff is like a nightmare sometimes. It's not very easy.
Okay, so it sounds like, just to recap, educating kids early. Do some kinds of community programs, so Connie's gonna propose a list potentially of that. Do some live streaming, Cassidy could help us out with that if it's adults or high schoolers. Evidence-based programs, public health or public information education campaign.
flyers.
What,
You mentioned flyers.
flyers?
I agree with that, Deb.
I think flyers are good, be like in the restrooms, those are
Yeah,
pretty
flyers,
effective.
and some restaurants, when we did all that Blue Zone stuff, they'd let you have like a table tent on the tables in the restaurant.
And town hall meetings,
Yeah.
Kathy mentioned.
And we could have those over multiple,
Derek, do you have a lot
do
of
some joint
kids on
things.
welfare low income
So,
to go to picnics? I know more
All
than
right,
it used to
anything
be.
else for the,
Really.
So what are you thinking, Dee, as far as next steps for meeting? Are we not, I'm just looking at the
open to input, what do we want to do?
next.
And when's a good time to meet?
Well, the
I
next
just know Tuesdays and Fridays are good for Elizabeth.
Okay, the
That's-
next ACT meeting would be March 11th at noon. Derek, I'll send you the,
Okay.
I'll add you the invite.
Okay.
Do you have his email?
Yeah,
Oh,
yeah. And Cassidy, you're gonna give us a little update on that same or you're gonna do the same
Yeah.
presentation you did for CCCP?
Yes.
Okay.
Yep.
You want to take a minute and tell everybody what you're gonna talk about?
Yeah, so it's
Please.
stigma associated with substance use disorder, and that just kind of focuses on how stigma affects people who do have a substance use disorder, why it's difficult for them to seek out treatment sometimes. It talks a little bit kind of about just how people in helping professions do experience compassion fatigue. I think everybody knows about that. And just really the importance of using person-centered language, changing the way we talk and treat people. There's a lot of quotes and different things like that from focus groups from people who are in treatment in Iowa. So you can get like kind of the firsthand how they were feeling while they were dealing with whatever substance use disorder they were dealing with. And off topic, I've been working on county needs assessments for the state for like the last, I don't even know, several months. Anyway, I just thought I would put out that for admissions to our treatment facility, specifically in Ottumwa, the people we have had from Jefferson County has more than doubled from 2021 to 2022.
Wow.
And what,
So,
tell us more about that.
Yeah, that's literally just for total admissions for methamphetamine. It could be heroin or other opioids. So fentanyl could be involved, or prescription pain pills, things like that. It could be polysubstance use as well. Polysubstance use, of course, is a big issue right now, whether they intentionally are using more than one substance or something is mixed in with something else without them knowing it. So that was just the data that we had from the treatment facility. And as I get more data about Jefferson County specifically, I'm happy to share that, just to, again, make everybody aware of what we are seeing.
And that would go back to Chauncey's point, that would make a good public education, just general messaging. It's here.
Are these adults? Are these over 18? Cassidy, are they?
Yeah.
What age demographics are we looking at for inpatient treatment?
I believe these are all adults.
Okay.
I could
That's
find out,
okay.
but I believe these are all adults.
Okay, I just wanted to clarify that what the age was.
Facility she's talking about for adults.
It is, but
Yeah.
sometimes sometimes a Judy ends up someplace and.
And I've got the notes from your presentation at DCAT, Cassidy, and what was nice about it, you did a great job and it's 15 minutes long. So for people that want to work this into either another meeting or a presentation of some sort, it's not a huge time commitment. And she has a lot of these, which are on that sheet that you
Oh,
have,
okay.
Derek.
Sure.
And I wrote down one website, maybe you can tell us more about this from your presentation, recoveryanswers.org/addiction.
Okay, so yeah, that one just really has more resources and information about people who are in recovery or trying to navigate recovery. I think we come across this issue that some people have the perception that when somebody starts recovery, it's kind of like a straight, smooth road. And we know that's absolutely not true. Especially when we're talking about opioid use disorder. I don't know the exact number, but the rate at which somebody relapses the first time after treatment, it's really high. The relapse rate is very, very high when an opioid is involved. And then another thing that we're seeing more of, and I don't know how many other places screen for this, but kratom use to intensify the effects of opioids. That's another issue that we've been seeing. And I know some of the other places that other counties that I work with, they are going to start screening for kratom as well, even though it is legal, just because of the issues it can cause when it is mixed with other substances.
What was that?
Great.
What is that?
They sell it here.
It's marketed as an herbal substance that can increase energy and focus or promote relaxation. Depending on how much a person uses will depend on the effects. 15 plus grams is what has opioid-like effects. 1 to 5 grams has like the effects of an energy drink, essentially.
How do you spell that?
KRAPON.
Thanks. You win a spelling bee.
Good job, Chauncey.
Thank you.
You win this paper.
See, that would make a good public service.
Yeah,
Somebody overdosed on that last year.
Yep.
Yeah.
No, I
It's
know that.
widely available at
Everywhere.
places.
I'm
Yeah.
sure if it's herbal. Very informative. All right. Well, I think just from this meeting, we have about 5 or 6 public service and potential announcements.
Amen.
So, okay, so back to where do we go from here? And how often do you want to meet? Any assignments? Connie's gonna work on something. Maybe we could, Elizabeth, Chauncey, pull together some topics for public service based on this.
Are we talking about like buying ad time or just telling Connor things or putting up a website?
I think the radio
We pay
station
for
would do
ad
it for
time.
free,
We do pay for ad times.
Well,
for
this
things.
is a meeting to discuss how to spend money.
right?
Yeah.
Well, I mean, yeah, that's a fair point, but I think to start, we might be able to get some public service announcements.
We do car seat stuff. We get free airtime and then we pay like $100 a month for advertising for the programs that we have at the health department. So we do both.
And then do
Under
we want to
education.
advertise elsewhere, you know, like, I don't know, KTVO,
Facebook.
definitely, yeah, that's a good idea.
Flyers.
Marketing and education.
We just
It'd
need
be a
somebody to
full-time
do all
job.
this and coordinate all this, right?
Well, and like I said, we used to do it with the ACT meeting, but it's, it's other duties as assigned. It doesn't come to the top of the list sometimes.
I've never played with it, but there's a way with Facebook, you can target certain areas,
Mhm.
right? So you can, hey, I'm
County.
targeting the county, I'm targeting, Pekin schools really heavy. So when parents are sitting there scrolling through Facebook, waiting to pick up their kids, you can target. And like I said, I know you can do it. I've never really played with it, but you can pick like hot spots. So like every school pickup zone and, stuff.
I don't think it's that micro targeted, but
I think you can.
they changed the rules.
Oh, did they really?
People were making ads for one person.
Oh, to make sure they'd see it.
Right.
The mental health group also
Yeah.
has done stickers and magnets for the kids and positive affirmations and my car is going to a lot of school events and that's getting some play. And the city of Fairfield is going to give them $500 to continue that program. So I could bring some of those, or somebody could bring some of those also, so you know what those are. So those might be useful for the kids program.
I have some of those, Connie, I can bring.
Yeah, okay, great. Deb, thank you. I mean, that might be a place where we might want to put some resources and maybe we want to tweak them a little bit better so they're a little more, I don't know, focused on what this group is doing.
And I know that he goes to a lot of like school events, right?
Yes.
So does he need permission from anybody to give away what he gives away? Since it's for kids?
He's working with somebody. You tell you the truth, I don't know. I don't know who he's asked, but I'm sure that he's getting permission.
Yeah,
And plus we're doing at public events too. So like we'll be at the farm show.
right.
And it's interesting. He said that, at the very beginning, particularly adults, when they go by the table and they would turn, like, I don't want to talk about mental health, but they're now kind of getting more interested and not getting so afraid to go to the table and say, what's this about, and get materials. And, you know, we try to gather materials from the different resources. So,
We have a booth there too. If you want to put anything over there, you can probably do that too if you want it at another location.
okay.
Okay. So back to, where do we go from here? When do you want to meet again?
Are we wanting to meet every month or is that too much?
I don't know. What do you think?
Or once a quarter or?
That's up to you guys, whatever you.
I think we need to come up with a plan and set
Yeah.
a plan in motion and then set
Yeah.
up a schedule, right? I mean,
Right.
at this
Yeah.
point, we just haven't really decided on anything.
Yeah.
Right, I need some deliverables, like how often are you gonna do a press release or education?
Exactly.
Who's gonna be working on that? Who's gonna, you know, Derek said he's gonna check out some curriculum. I think we all have our own little, we're gonna get some data. I mean, we're, you know, we've all
Okay.
got,
Yeah,
I think we've all got
So what
something.
about meeting in 2 months in April?
okay, yeah, okay, we can do that. And I'll work with Elizabeth and
Of course.
Chauncey and reach out to anybody if I've got questions, just to try to help. And Abby, because she's taking notes.
The fourth Tuesday would be April 23rd.
Tuesdays work okay for people?
Yeah, that Tuesday does, not the first.
I like the
Tuesday.
idea of 2 months, Connie.
Well, it goes by so fast. And
Do you
this-
want to meet earlier in the morning, like at 8:30, or does this time work? Okay, it doesn't matter. We have a lot of people here that like to meet early.
I think
8:30 is better for me.
April 23rd.
8 or
I don't
8:30.
know if this affects anyone, but I believe that's the first day of the governor's conference.
Doesn't affect,
No,
Yes.
the public health conference, or is that the substance abuse conference?
Substance abuse.
Yeah, because
Yeah.
public health conference is like the 25th, so, okay.
Okay.
Do we want to go to the 30th?
Actually, I think it's the ethics part of it.
Are you gonna be at that, Cassidy?
Undecided yet.
If it's a first day, does that start at noon or late afternoon or early?
I think that day, the first day is a half day, and then the following two are full days, if I remember right.
So if we met at like 8:30, does that work?
Yeah.
Somebody, I doubt if anybody, unless Cassidy would probably be the only one that might go to that. Okay, 8:30 on the 23rd
Here.
here. Is that okay? Yeah, we've got Zoom. That's kind of why. And obviously, we didn't have a capacity issue with the room today.
Wow. Hopefully we will next time.
We'll keep trying.
Hey, all you can do is try, all you can do is offer it, all you can do is send it out, and
And we know everybody's busy, so we appreciate those of you who were able to attend. It was very helpful. We got to start somewhere. And remember, we have at least 16 years.
I'm not gonna be here in 16 years. I'm here to tell you, I'm
Never say
retired
never.
before that.
Chris will be volunteering for this.
No.
By then.
I'll be doing some other fun stuff, like going fishing, you know, doing outdoorsy things.
Okay, what are we on opioid work
Perfect.
sessions?
Is that what you want on the
Thank
agenda?
you.
Yeah, opioid
Thanks, you
work
guys on
sessions.
Zoom.
Thanks,
Zoom links.
everybody.
Substance abuse on there.